Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and welcome to our show. We're here with our wonderful guest here, first time on our show, Dr. Will Kelly.
Thanks guys, good to be here.
Out of Ann Arbor, Michigan. And I want to start off, Doc, by hearing how you got into the profession. What inspired you to become a chiropractor and your history with your background?
Yeah, my family come from a pharmacist background, and so from a young age, I think I was about 14, and that was pretty much decided for me I was going to be a pharmacist. So I was going to school in Newfoundland for pharmacy, but I was actually a member of the judo team. I did judo for 5 years, which was it's an amazing sport, but it's pretty rough. If you learn it later in life, you don't learn how to fall correctly. So it's not so much getting thrown is bad for you. It's the landing. So after a few years of judo, I started to get a lot of symptoms relating to my back, where I would take a deep breath in and I'd get like a shooting, like lightning down my spine. And I had two choices. It's like, okay, you can breathe and have this pain down your spine, or not breathe and eventually pass out. And it got so bad, it was weeks at a time. I would just be kind of laid up in my dorm room, going through a lot of symptoms. And I did a lot of muscle relaxers. I did some physical therapy. I had an orthopedic consult, and they were talking like, I think it was thoracic disc and surgery. And so my parents sent me to their family chiropractor, and he explained chiropractic to me. I almost felt like I should have figured it out on my own. It was so awesome. He's like, see that, he kind of showed the spine and the nerve pressure, and I started getting adjusted, and immediately I had a reduction in symptoms. And he basically went to me, you could be a pharmacist, or you can do what I did every day for the rest of your life and take these hands anywhere in the world and do what I did. And so I made the choice then to switch over to chiropractic. The amazing thing, pre-pharmacy and pre-chiropractic were the same course requirements. So I didn't have to do one extra course. I transferred, and next thing I was in Iowa, and it was the best decision I've ever made, because a lot of time, like a couple of weeks ago, we were talking to young kids, decide what they're going to do for the rest of their life. The first choice people come across typically is more medical.
Allopathic model.
Allopathic model.
And a lot of times, a lot of people see, and their public perception is that there's a big controversy between chiropractic and traditional allopathic model. Mm-hmm. But now in modern United States, there's really not as much of a controversy as you think. A lot of people think that medical doctors are against chiropractors and chiropractors are against medical doctors, and vice versa. Now, our approach is a little different. We're more based on natural health and healing, and keeping it within the body. And the allopathic model a lot of times is from the outside in, with drugs, surgery, things like
absolutely.
that. And not at all that there's not a time and a place for both. And absolutely we should work together. And now in my community, I get referrals of patients all the time from family medical doctors that know that what I do is in its own a distinct, unique healing art, and that should be used in accordance. And so they send me patients, and vice versa. If somebody comes to see me with a broken arm, or they're having a heart attack, I'm absolutely going to send them right out to the hospital or the medical doctor, depending on what's going on, directly there.
Yeah, the only thing I've found is they just want communication. A lot of times I've sent to a chiropractor before, and they won't hear from the patient. And so, like, we write, we'll do our exam, our X-rays, write our medical notes, and keep in constant communication with their medical doctor, and things are fine. That's the biggest part of my practice. And patients always come in, I heard you guys don't get along with that professional. I'm like, well, that's probably the hugest part of my practiase. So I get along with plenty of people.
You need to have normal communication.
Yeah, we've established that communication.
And even the bridge in between the normal communication is, like you said, you came from a pharmacy background, so there needs to be communication between the medical doctor and the patient, between their pharmacist, and also between the pharmacist to the patient to the chiropractor.
Absolutely.
Because it's important for us to know what medications they're on. We need their medical doctor needs to know if something doesn't mix with something else, and their pharmacist is the one that's going to dictate that to them.
Absolutely. Absolutely. Yep.
So let's talk a little bit about, as you're going through judo and you're in sports, you were under chiropractic care, which was, that's your testimony. And most people that go into chiropractic, a lot of people have had a testimony where they've had a personal experience, a life-changing experience through it. Now, as far as chiropractic in sports, chiropractic and athletes, I want to get into that a little bit with you. I know that you're a major athlete yourself, so let's talk a little bit how chiropractic can help people in athletics.
Absolutely, and it's at higher level athletics. You know, you're looking at your races that come down to a fraction of a second. You know what I'm saying? Wouldn't you rather be the competitor that has no nerve pressure between your brain and your body versus the competitor who maybe didn't get a chiropractic adjustment and actually has pressure? I mean, you know, the nervous system controls every single muscle in your body, so you cannot, you know, that's something at the higher level you just you can't avoid. You have to get adjusted.
It doesn't even matter what sport it is. If your spine is in normal alignment, if your nerve system is functioning at its optimal, chiropractic can definitely help increase overall performance of the body. For example, you know, now most professional sports teams all have a chiropractor. I'm actually the team chiropractor for a few semi-pro football teams. For the women's professional football team, I've taken care of professional golfers, professional bowlers, dozens and dozens of different athletes in my career already in chiropractic. Now let's say here the nerves in the lumbar spine are being blocked, or even that there's just restriction of the joints in the lumbar spine. And let's say that this individual who owns this spine is a kicker, and they're a football player and they're a kicker, right? If they have a restriction from the spine moving side to side, that's going to increase the likelihood that their kicks are going to be veering off one side or the other.
Absolutely.
And so there's a chiropractor that I've heard on a few speaking engagements that was a professional football player for the Denver Broncos, and as he became a chiropractor after he had retired, he was played in one of the Super Bowls, actually I think it was Super Bowl 12, and he noticed that. He noticed with all these kickers that when they were missing their kicks that they had the restrictions in their lumbar spine. He started taking care of some of these players and noticed huge improvement in both the range of their kicks and the accuracy of their kicks. You know, if there's a blockage there, of course they're not able to rotate the hips and pelvis as they make their kick properly. Yeah. And that actually happens in lots of sports. If there's a blockage in the hips or pelvis, if the lumbar spine or thoracic spine aren't turning correctly, when someone's golfing, obviously their swing isn't going to be right. So we see
a ton of golfers.
Awesome results with golfers, both with the distance of their drives and the accuracy on veering to the right and left. So I take care of dozens of golfers in my office. I've taken care of professional golfers.
Yep, absolutely, absolutely. The one thing I have noticed is that a lot of colleges and universities tend to be more physical therapy in nature, so it's kind of hard to get established as a chiropractor per se at a university because they have the programs there. You know, chiropractic is private school, so that's one thing you'll notice. You know, if you have a younger athlete, I have a lot of patients that bring their kids in that get adjusted in the office. Kind of, they're not so much in line with the university because, like I said, chiropractic is private school, university, and mainly physical therapy. But if you look at the pro, as soon as someone breaks into the pro and there isn't that tie to the school, you'll see the chiropractor adjusting someone on the sidelines, or the chiropractor adjusting the hockey player. As soon as it's done, as soon as you get to the upper level, like Tour de France, all the PGA stuff, you'll see chiropractors pretty rampant. But unfortunately, when a lot of athletes when they're in university or college, there's a little bit of a political roughness there that unfortunately not everyone gets through, and that's kind of.
And it's starting to break down a little more now because they realize the results with chiropractic care with some of the athletes. But as you said, most of those universities have physical therapy programs. They feed people right from the program right to the sports teams, and they take care of them there.
Absolutely.
But in the pro level, the chiropractor and the physical therapist can work hand in hand, side by side. And really the difference, a lot of people think that there's a struggle or a fight there between physical therapists and chiropractors, just like they believe that there is between medical doctors and chiropractors. But it's just, again, a difference in approach, but we can absolutely work with them. And I work with many physical therapists in my area, refer to them, get referrals back from them, and so on and so on. But what our goal, again, is to deal with the alignment of the spine and the alignment of the bones and the joints and how it deals with the connection in these nerves that come out here and how they function properly from the brain, the connection through the nervous system to given organs, tissues, glands, cells in the body. So what the physical therapy approach is more to do with the muscles. So even on these vertebrae themselves, you see on my other model here, there are muscles and ligaments surrounding the spine. So what we do as a chiropractor is we move the bones and get the normal alignment right back to one another, where physical therapy, where the difference is they're dealing with the muscles to help the muscles strengthen to be able to hold it there. So we can work hand in hand where we get the bones moving, they can help re-strengthen the muscles, and we see that in athletes, and that's where we have really the best results, is where they bring in a chiropractor to work hand in hand with the physical therapist, and what we do is totally, absolutely different. A lot of people think it's the same, or that through their athletes, they should go just physical therapy. But we work great with them by keeping the spine, the body, and the bones in normal alignment so that the body can function and heal at its optimum genetic potential.
Yeah, I've noticed my happiest patients is when we co-manage. When I'll take care of the nerve pressure and they'll do their physical therapy. I mean, you just got a lot of happy people, but when there's, when we're not doing that, they come in kind of frustrated because they're kind of getting different answers.
And that's especially when we get to the highest level of athletics. And I've taken care of level 10 gymnasts, and these gymnasts, they have a tremendous amount of trauma happening in their spine constantly. As they're doing, they're tumbling, as they're on the high bar, as they're flipping around, they're really putting a lot of trauma on their spine, on their nerve system, especially. Even though they're very flexible, you see how far back they bend.
Oh, yeah.
You see how their body gets put in different contortions. And so, of course, they want the physical therapist to help their muscles, but we want to remove the pressure, remove what we call subluxation, which is the interference in the spine, which can put pressure on the nerve system and impair normal, healthy function.
Absolutely.
And then you see, again, like with martial arts and judo, those are, without question, causing massive
time.
trauma to the spine.
Big time. I actually met the chiropractor for the Estonian Olympic judo team that I guess Estonia never placed at all ever in the Olympics. And he does a special technique where he does adjust, but he does a lot of muscle bouncing too. And he adjusted. He's judo athlete right before the match, and he went out and got I think it was bronze about 6 years ago, I want to say, and like the first medal Estonia ever had. So this guy, like he's like a rock star. I mean, he's got CDs out. He's got his own radio show. I mean, this guy, because he'll take a 200-pound athlete, and with one pinky, he can lower this guy's arm because he's got a subluxation. He's got a pinched nerve going to his deltoid, and he's supposed to win a judo match. And like he was just so weak there. So yeah, it's at that upper level. It's just, I mean, every little thing counts. And I mean, why not?
I have a really good friend of mine is the team chiropractor for the U.S. Olympic wrestling team. And that's another one.
Wow.
Those type of activities put so much trauma on the spine and on the nerve system. And as we correct those imbalances, correct the nervous impulse, it increases the overall performance. So we have a short video clip that I'd like to roll, and this is, one of the all-time greats talking about his experience with chiropractic. This is going to be Jerry Rice, wide receiver, a Hall of Famer, talking about his experience with chiropractic and how it really kept him in the league. Jerry Rice was known that he wasn't out many games at all, didn't really have an injury, stayed healthy his whole football career, and he played for a huge number of years and was very successful. And again, he was Hall of Fame, one of the best wide receivers of all time. He's going to talk to us here a little bit about his experience with chiropractic. So I'm going to roll that video clip here.
Hello, I'm Jerry Rice, and I am pleased to be talking to you about my experiences and the value of chiropractic care. I believe in chiropractic, and I know that it works. You probably know about my long and successful career in football. I'm flattered by the testimonials to my durability. Football is a very rough and vigorous sport. Many of the pass patterns in a game, either long or short, required a maximum effort. I took some vicious hits from players nearly twice my size. Thankfully, I had the durability to withstand these tackles, or I would have never succeeded or lasted as long as I did. Chiropractic was the key to keeping me in the game. My first experience with chiropractic care was right before the 49ers were to play the Bengals in Super Bowl 23. A couple of our players were injured, and a chiropractor turned things around. I quickly became a believer, and ever since, I have had the benefit of chiropractic care. Dancing with the Stars was every bit as exhausting and challenging, though not nearly as brutal as football. It required many hours of practice. I had aches and pains that I never had before. Again, chiropractic made the difference and kept me dancing and in the competition. The game of life requires the edge that chiropractic provides. Chiropractic care helps me to lead a very active lifestyle. I have seen its value both personally and professionally among my friends and teammates. But most people aren't aware of the benefit of chiropractic. That is why I support the efforts of the Foundation for Chiropractic Progress. They promote chiropractic through consumer education outreach.
It was an awesome clip.
That was great.
And Jerry Rice, we know he's one of the all-time greats, and he's telling us how it really kept him in the game. Absolutely. Now, I go every year, actually, to the Arnold Classic, which is a seminar that Arnold Schwarzenegger's been putting on an athletic symposium. He's been putting this on for, I think this is their 17th year now, and they have thousands and thousands of athletes. They have people from bodybuilding, martial arts, gymnastics, ping pong, you name it. And every year I go and I see Arnold comes and meets with the International Chiropractic Association delegates there for our fitness symposium, because I know Arnold Schwarzenegger was a big advocate of chiropractors, and I meet him every year. I take a picture with him.
Yeah.
He used to not even do one of his movies unless he'd bring his chiropractor with him
Yeah.
to get adjusted before he would do the movie.
Yeah, a lot of musicians do that. And I know he's good friend Franco Colombo actually transitioned into chiropractic too, which is great.
Yeah, he's a bodybuilder as well.
Yeah, as far as politicians go, he's just so in the know-how with chiropractic. It's really good to see.
And they're really making a lot of advances in chiropractic in California, specifically because of Governor Schwarzenegger.
Yeah.
So I want to switch over and talk a little bit about, there's a very big misconception in the public and in the community that people that go to chiropractors, that chiropractic can lead to strokes, especially with cervical spine adjustments. So I want to go through and talk about that rumor and really dispel that rumor. There's been so much research disproving it, absolutely, that most people don't hear about, and they hear from a friend, a neighbor, or so-and-so that they heard that chiropractic can cause strokes.
Yeah, that's the big one we deal with. And if you actually look at the two causes of strokes, it is arthritis and high blood pressure. It's agreed upon across the board. And I tell people, why do you think you get arthritis? Like we talked about, we're going to talk about here in a bit. Arthritis is just poor misalignment over time causing degeneration of the spine. So it's ironic that someone would keep away from getting adjusted where the adjustment's the only thing that could prevent a stroke with eliminating arthritis. And also, if you look at it was on Good Morning America, the blood pressure study out of University of Chicago Hypertension Center, where they could deliver, through 50 people, deliver one adjustment, and 8 weeks later, the blood pressure is down 17 points across the board after one adjustment with a specific upper cervical adjustment. So from our side, you're seeing that the two causes of stroke are we're the only people that can address them naturally. And, but people are coming in and they're afraid of getting their neck touched. If you look at if you just run through the statistics of it, it's almost foolish to think that. I mean, actually, my father had a stroke about 2 months ago. He's back home in Canada, hasn't been adjusted in a year. But I guarantee you, if I had touched him, a week later, they'd be saying, well, what happened? Oh, your son adjusted you. Ooh, okay, yeah, he probably gave you a stroke. I mean, that would hit close to home. I mean, one in 1,000 people, no, 1 in 3,000 people have a stroke every year. And it's just a numbers game. If we have a very high volume clinic and you're seeing 300 and 400 people a week, it's going to come to be a coincidence, which is what
People
one in
have them
how
anyway.
many? Yeah.
As far as coincidence goes, a certain percentage of people, you could say, have a stroke after they eat a piece of pizza.
Absolutely.
Does that mean it's a causative effect that eating pizza causes stroke?
Yeah.
No, of course not. There's a higher percentage someone could have a stroke leaning their head back to get their hair washed at a salon than they would having to see a chiropractor. Absolutely. And one of the big things is that because the chiropractic adjustment is so gentle and so specific, it's not just a gross turning of the neck or head, like a lot of people think that it is.
Absolutely.
And there's been so many research studies going on. I know the World Health Organization just did a big one, but I have some numbers here actually that that we know that it's a fact 99% of strokes occur within the brain, and so the chiropractic adjustment isn't dealing with up in the brain. We deal with the nervous system flow from brain to body, but we're not dealing with a head adjustment or a brain adjustment. We adjust the cervical spine, right? And so only 1% of strokes even possibly occur in the neck, which is anything that could even possibly be associated with chiropractic care. Now, research reveals that between 1 in half a million or 1 in up to 10 million chiropractic adjustments may have a stroke after that, right? So here's some relative numbers to put that in perspective. So 1 in a million to 1 in 10 million, right? People can have a stroke after the chiropractic adjustment. Being struck by lightning is 1 in 700,000. So you have a better chance to get struck by lightning than you do to have a stroke from a chiropractic adjustment. Drowning in a bathtub, 1 in 818,000. You have a better chance to drown in a bathtub. Having a fatal fall down a case of stairs is at 1 in 180,000. So you have 10 to 20 times more likely to die from falling down stairs than having a chiropractic adjustment. So be careful of stairs. Don't go downstairs, right?
Yeah.
And then accidental suffocation in bed, 1 in about 500,000. So you have 2 to 10 times more likely chance to just suffocate in bed than you do seeing a chiropractor. So don't go to sleep, right? You could just die. So that's people are telling people not to see a chiropractor when they have a better chance of dying from being struck by lightning, suffocating themselves in bed, or drowning in a bathtub.
Yeah, absolutely.
So there's really no causative effect. If chiropractors see enough people, eventually someone's going to have a stroke, but it has no causative effect on cervical spine adjustments.
Exactly, and a big thing to understand too is an exacerbation of a stroke. Like if you had a problem and you came in and you had like your face was numb and it was the worst headache you've ever had in your life, and we were to adjust that, yeah, we would be irresponsible because there was a problem. But if you came in where there's no symptoms whatsoever and something happened, like we said, it's just one of those things. It's a numbers game. Eventually, it'll happen. But I don't want people to have the idea that you always see it. Whenever it happens, it's the very soppy 2020 when all Sarah wanted to do was go in for some neck pain, and the next thing they'll show her in trouble after the adjustment. I don't want people to think that someone shows up with this perfect vertebral artery and Chuck Norris or Steven Seagal comes in the room and tries to rip their head off. It's just one of those things, underlying things that are there, and it happens every now and then, but there always is an underlying problem, and it got exacerbated at a doctor's office, which you'd want to be at a doctor's office if you had a stroke.
And so the Steven Seagal and Chuck Norris thing, when they come and rip off the head, it's not, the spine and the head doesn't work just like they see in the movies. They make it look like it's so easy for somebody to just jerk their head and someone dies. First of all, the chiropractic adjustment is nothing like that. It's a specific, gentle, extremely specific way of moving individual bones to take pressure off the nerves. It has nothing to do with those general gross things that you see them do in Chuck Norris or Steven Seagal movies. But even that, they can't do that with such ease and such little effort. That we have so many muscles, so many ligaments, so much tissue around our spine, around our nerve system that you can't just rip a head off like they show so easily in the movies. And that creates a big misconception that people see that and they don't want to see a chiropractor because of the Chuck Norris movies.
Well, a lot of studies show too, your head weighs more than the pressure it takes to move a vertebrae. So I tell people, if you're afraid of getting an adjustment, you should be afraid of sitting down right now like I am, because just the weight of the head on those structures is 14, 15 pounds. So if I'm going to go and make a little nudge and a specific adjustment, I mean, there's nothing. I mean, that's not a lot of force.
So to sum that up again, so for our audience out there is not, as the misconception shows, the causative factor between chiropractic adjustments and strokes. And another thing that we'll say is that a lot of times when somebody has carotid artery blockage or vertebral artery blockage coming in, what we do is a lot of times don't even necessarily do a manual adjustment on the neck. We want to make sure to be cautious of the arteries, be cautious there in the neck. Anyway, we use sometimes lighter force, things like instruments. We have specific tables that drop up and down to use the mechanism of force to help move the bones rather than using any rotation whatsoever at all. This is an instrument we call the chiropractic activator. And it looks just like this. As we pull the trigger here, pushes a force through the body. It's a higher speed, lower force way to help make adjustments in the spine. So a lot of times the people that are afraid of cervical spine adjustments or of hearing the cracking sound in their neck will use more things like this activator or like the drop adjusting tables where they don't hear the cracking sound going on in their cervical spine.
Yeah, which is an air release, by the way. A lot of people think bones are rubbing together making that noise. It's just there's essentially a vacuum between the joint, and when you move it, like popping your knuckles, it'll just make that, the air will go in and make that noise. But so it's, people think, oh, I don't want bones rubbing together. It doesn't happen that way.
It's exactly right. It's the air bubbles, the CO2 and nitrogen gas, as they're changing state. They're coming in and out of solution. So as you open up the joint, it makes a little popping sound. As you open it up, there's two ways that it can cause a state change or them to come in and out of solution. One would be a major increase in temperature. As you increase temperature severely, there's a state change. Or the other is a severe decrease in pressure. So we use the decrease in pressure. We don't really want to cook anybody.
Yeah.
Technically, if you cooked someone's joint, eventually it would pop before they died. But we don't do that. We decrease the pressure of the joint. And so where there's a fast decrease in pressure, the air bubbles, the CO2 and nitrogen gas come out of solution and makes this little popping sound. It's not bones cracking, snapping, or popping.
Exactly.
No Rice Krispie, snap, crackle, or pop going on there. It's just pressure, air bubbles coming out of the joint space.
Absolutely.
So another big misconception, we talked about stroke. We talked about the popping and cracking sound. People that are often afraid of those. There's ways to do the chiropractic adjustments without those popping and cracking sounds. But there's no harm done by having those sounds. And I want to get into another big misconception is the school process. A lot of people feel that chiropractors go to school a lot less than other types of doctors, than in the allopathic model, or than a lot of degrees in general.
Yeah, absolutely.
So let's talk a little bit about the schooling process that it took to become a chiropractor and how credible chiropractic as a profession is because of the class that we took, because of the hours of neurology, the hours of anatomy and physiology, the hours of biomechanics, and all this kind of stuff.
Exactly. And I tell people too, it's not also, what you know, it's your approach to it. As a chiropractor, I tell people about, the kidney. I could be a renal physiologist when I know everything, how the kidney works, and I want to be able to fix that if something breaks down with that part of the body. But ultimately, as a chiropractor, my job is to get rid of the nerve pressure going to that kidney so it works to its highest potential in the first place. So we do learn, you do learn the class of the anatomy, physiology, the diagnosis, and so you know how every cell, every system of the body works. But we're different. We're not waiting till something were to break down and fix it later. We're trying to maintain it throughout life before anything happens. We don't want to, symptoms are the last thing to show up and the first thing to go away. We don't want to.
That's a great point, that our approach is holistic, meaning we want to deal with the body as a whole, and we want to see the connection from brain to body, our master power supply, our master control center, which is the brain, and its connection through the other organs. Now, someone can have a problem with a specific organ, an eye, an ear, whatever, and there may be no problem in the eye and no problem in the brain.
Mm-hmm.
Now, if there's a problem in the eye, of course, they want to go to the right person to take care of the eye itself.
Mm-hmm.
But if there's no problem in the eye, there's no problem in the brain, we want to make sure there's the right connection between the brain and the eye, and that's what we do as a chiropractor.
Absolutely.
I've seen a patient of mine that I've been taking care of for years now. She had a kidney replacement in her early 20s, right? And after this kidney replacement, her kidney she'd begun renal failure. They had checked all her blood, urine, nitrogen, and creatinine levels, all of her kidney function tests. They had done a kidney replacement. Now, there was a reason that kidney had shut down in the first place. They replaced it, and now what do you think was happening 10 years later to the new kidney? Shutting down again, right?
Exactly.
So the new kidney was shutting down. And so no one ever just thought to think about the connection from the brain to the kidney and how that's normally replacing healthy tissue and healthy cells. So as I started taking care of her, as she started regular chiropractic care, believe it or not, all of her kidney function tests started to normalize. Her creatinine, her blood, urine, nitrogen, all of her kidney function blood work started to normalize.
Yeah.
And there's not necessarily a problem in the kidney. There's a problem with the connection to the kidney, and eventually there became a problem in the kidney itself, and they had to replace it. The kidney started to shut down. But perhaps if we would have addressed the problem right in the beginning and there was no misalignment or no disconnection between the brain and kidney, we could have seen much better results.
Absolutely.
So I want to ask you a little bit about the schooling process itself that it took to become a chiropractor and the hours of education that you have as compared to somebody in the medical professions.
Yeah, well, when I started, like I said, I did pharmacy. I was entering into pharmacy first, so I did a Bachelor of Sciences, which is, involved a lot of Red Bull, and I grew a beard for a few years. So the tough stuff, the calculus, the physical chemistry, organic chemistry, and once entering chiropractic college, it is still a 5-year PhD. But if you go straight through, it can bring it down to about 4 years. And the first year is the gross anatomy part of things. You learn every cell, every system, every ligament, every nerve track. Every single possible thing you can learn about the body, you'll learn in that year. It's kind of the sink or swim phase. I say there's a lot of people, you'll see a lot of people don't get through that part of school. And then the second part is more the diagnosis, putting everything together, patient management. And then the last part of school is patient management, actually adjusting, that's being a chiropractor, getting rid of subluxation, that's what we're going to do every day for the rest of our life. But if you look at certain subjects like neurology and gross anatomy, we have about 2 to 3 times more studying in school. Like we go around 500 classroom hours in neurology, where a lot of doctors go up for about 150, 200. I think it's not enough. I mean, aside from knowing where the brain is and what a nerve is, 200 hours, a lot of people, they just don't have an appreciation for the nervous system like we do.
The school process we went through is definitely a major endeavor, and we learned, I always tell people, to be any type of doctor, most of the classes are the same to be every type of doctor. We take the same classes as neurologists, we take the same classes as medical doctors, we take the same classes as pediatricians, any other type of profession, veterinarians, dentists. The schooling process is fantastic. And we're just about out of time today, so I really want to thank you, Doc, for coming on our show today.
It's great to be here.
It was great to educate our studio audience. So again, I'm Dr. Adam Rodnick. Thank you for joining us on Ask the Chiropractor. Remember that God gave you the gift of life, and what you do with that gift is your gift back to God. Thank you again. We'll see you next time on Ask the Chiropractor.